healthcare costs, particularly when you're tracking chronic conditions like type 2 diabetes mellitus, T2DM. It's a huge challenge for so many people.
It really is. It often feels like this massive, sort of overwhelming problem.
Exactly. But what if we could actually, zoom right in, meticulously measure every single cost, and then connect it directly to how patients are actually doing?
Well, that's precisely what we're diving into today.
Yeah, we're looking at this fascinating study that did just that. It used a pretty unique method called time-driven activity-based costing, TDABC, to really break down what T2DM care actually costs and, crucially, the value it delivers.
Right. And our mission here is to unpack how this study managed to measure those costs so precisely across all the different places people get care, primary care, hospitals.
The whole spectrum.
The whole thing. And we'll get into some honestly surprising financial differences depending on the patient's condition.
Yep.
Stable versus someone with serious complications.
And linking that cost to the actual health outcomes. That's the key bit, right?
Yeah.
Getting a clear picture of healthcare value.
Exactly. Value that goes beyond just the sticker price. It's about what we get for what we spend.
Okay, TDABC, it sounds a bit like accounting jargon. Could it get, bogged down in the details? What makes it so different for healthcare?
That's a fair question. But what makes it kind of revolutionary here is that it doesn't use broad averages. Instead, it builds costs from the ground up, activity by activity.
Okay, so how does that work in practice?
Well, think of it like this. Traditional costing might just say, okay, a clinic visit costs X amount, kind of a blunt number.
Right, an average.
Yeah. But TDABC looks at every single thing that happens in that visit. How long the nurse spent with you, the doctor's consultation time, the lab tests, even the admin time for booking it.
Wow, really? Down to that level?
Down to the minute, potentially. It figures out how long each step takes, who does it, what resources like equipment or rooms are used. It gives you this really granular patient-level cost.
And that's important for something like T2DM because...
It's chronic. It involves many different people, different settings over a long time. You need that detail to see where the money's really going.
That makes sense. So this study applied TDABC to specific patient profiles. 6 of them.
Yes, exactly 6. And they were designed very carefully to represent let's say, the typical journey and different stages of T2DM.
So ranging from someone doing well to someone not.
Precisely. It went from a stable patient whose blood sugar was consistently well managed, that's optimum control, all the way to someone who'd had a heart attack, a myocardial infarction, as a severe complication.
Okay. And for each profile?
For each one, they mapped out the entire 12-month cycle of care. They collected data on, everything: personnel time, facility use, equipment, meds, the works.
That allowed them to really pinpoint the true cost drivers, I guess.
Absolutely. No more guesswork.
So let's get to the results. What happened when they compared these profiles? I'm guessing the numbers tell a pretty stark story.
Stark is putting it mildly. The cost differences are, frankly, jaw-dropping.
Okay, give us an example.
All right. Take that stable patient, profile 1, with optimum blood sugar control. Their total annual treatment cost, just €798.
€798 for the whole year, including meds.
For the entire process of care.
Yeah.
All the activities, appointments, resources, plus the medication costs for that pathway.
Okay. And the other end of the spectrum, the patient with the heart attack.
Patient profile 6, the estimated annual cost there, $21,926.
Whoa, $21,000 compared to under $800.
Yep, over 20 times higher. It's a staggering difference.
That really is like the difference between, changing your car oil regularly versus letting the engine completely seize up. Huge difference in cost and outcome.
That's a good analogy.
Yeah.
And it's not just those massive acute events either.
What else did they find?
Well, chronic kidney disease, another serious complication, came in at around $3,791 annually. Active foot disease, like ulcers, was $3,933.
Still significantly more than the stable patient.
Orders of magnitude higher, yes. It highlights this crucial point. Complications are incredibly expensive compared to maintaining someone at low or moderate risk.
So what drives those costs up specifically? Is it just more doctor visits?
It's more complex. The study found costs are heavily influenced by, yes, the duration of care, but also the total hours of practitioner time, and importantly, the mix of skills involved.
Okay. So different specialists, more intensive nursing.
Exactly. A stable patient might just need their primary care doctor a few times. Someone with a foot ulcer They need specialized wound care, frequent nurse visits, maybe surgeons, podiatrists. Each brings different expertise, different time commitments, driving costs up.
So, tying this all together, what does it mean for value in healthcare? We kind of know prevention is good, but this study puts a real price tag on not preventing complications, doesn't it?
It absolutely does. It's almost shocking how clearly the numbers show it. It takes prevention from being just, a good clinical suggestion
Pretty nice to have.
to an undeniable economic imperative. And it's backed by precise data that older costing methods just couldn't provide.
So, the study clearly shows that putting resources into preventative care, things like patient education on self-management, getting resources right in the community.
It's not just good for patients' health, it dramatically cuts the huge financial burden of T2DM complications later on.
That difference, again, $798 for stable control versus nearly $22,000 for a heart attack complication, it really does speak volumes.
It makes the case crystal clear. Investing wisely upfront saves enormous costs and suffering down the line.
And for you listening, I think the practical message here is pretty stark too. Understanding this true cost, this value, really hammers home how a relatively small investment early on
In managing the condition well.
can prevent not just massive costs, but genuinely improve lives. So here's a final thought to leave you with. If knowing these precise costs for diabetes reveals such clear value in prevention, what might this kind of detailed, activity-based costing uncover for other major chronic health challenges? Maybe ones you're facing or just curious about, something to think about.